My name is Winnie Nzioka. I'm the facility in charge at Amref Kibera Health Centre. The President's Emergency Plan for AIDS Relief, that is PEPFAR, was introduced in Kibera, Amref in the year 2003. By then, we cannot take for granted that we celebrate 15 years of these efforts of PEPFAR in efforts of diverting epidemic of HIV. When we started, our clients used to be very sick. We used to receive clients who were very emaciated and clients who had lost hope. Actually, clients who were just left to die by their relatives. And we used to put them on treatment, and working with community health volunteers, we could do a lot of home visits, before tracing, home-based care to ensure that they take their medicine as required. In 2003, we did not have any information about HIV. And if I can recall very well, we were only trained 3 service providers in this health facility. And we did not have reference books or the internet to refer. We were only depending on 2 staff who were coming from CDC. I remember that was Dr. Macharia and Ms. Odilia. And managing the clients was not easy like today, because today at least we have everybody. It's like we have networks. We can refer, we can consult, we can also Google, the information is readily available. During then, the migratory nature of our clients really affected our management, since most of the community people would move from slum to another slum, or from slum to the rural areas. We'll find that tracking them was not easy because of the part of adherence, simply because the technology was not there. We can talk of phones, just how we could track them. It was not easy. So adherence was not good by then. But today, at least we are happy. Even if people, they move, they can communicate and tell us how we can get them and how we can deliver drugs to them. Adolescents, we didn't have the know-how on how to inform or to disclose to them, because when we were recruiting our clients, they were just coming in, and even the guardians did not have the information on how to disclose to their adolescents. Majority of our pediatrics by then, they were coming in with their grandparents or their guardians. So this is a girl or a boy who will take drugs, and when they start reaching their teen, they now start questioning, why should I take these drugs forever? So for us it was challenging, but now we are happy because we have been trained and we know how to handle the adolescents. And disclosure, we are trying to start as early as 6 years. So by the time they are transiting to adolescence, now they take charge of their treatment. Taking drugs, our clients used to have this pill burden, because they could take more than 5 different tablets of ARVs. And during that time, our clients could single out and say, maybe they could identify with the color, this white one, this blue one is the one which makes me vomit. And you could find that clients used to isolate some drugs. So achieving our viral load by then was difficult. Thanks again to technology, because at least we have combined pills and clients cannot isolate a certain drug. And on top of that, now we can now talk to our clients and we can achieve at least undetectable viral load. In this facility, the initial providers, we were only 3, and we were stigmatized even by our colleagues, because they could label us as madaktari wa virusi, yes, meaning the virus doctors. So associating us with the HIV client, that was enough stigma. When this antiretroviral therapy was introduced, majority of our community people could only associate our facility with HIV. And now that our facility is integrated, a model, we offer many services. So we were like the other services, our clients were not coming simply because of the stigma which the facility was associated with. Most of the time, even telling a client that we want to test them for HIV infection, it was a stigma by its own. But if we compare with today, at least that stigma, I think people have overgrown it. I take this opportunity to appreciate PEPFAR for your concern and your support for the last 15 years. Mine is just to say we are not tired. We are ready to reach the youths who are still in the community. We are still ready to reach our men who are not coming for the treatment. And given another opportunity, I'm very sure we'll cover all the clients.